Central line-associated bloodstream infections, also known as CLABSIE, are hospital-acquired infections that can be prevented if we follow the appropriate guidelines. This video will review steps we can take to protect our patients from CLABSIE. Let's get started. The physician wrote an order to give Opal a central line. Central lines are invasive lines that can increase a patient's risk of developing an infection. Central lines should only be inserted if there is a valid reason. Opal is on a medication called amiodarone that can be caustic to the veins. Caustic medication administration is a valid reason for a central line. Other acceptable reasons for a central line include invasive hemodynamic monitoring, total parenteral nutrition, administration of noxious agents, hemodialysis, and temporary transvenous cardiac pacing. We need to educate Opal on how to prevent a central line-associated bloodstream infection. One way we prevent central line infections is by following our CLABSIE bundle, which consists of hand hygiene, maximal barrier precautions upon insertion, chlorhexidine skin antisepsis, optimal site selection, and daily review of line necessity. All central lines should have a clean, dry, and intact dressing in place at all times. The dressing should be changed every 7 days or as needed. We must adhere to sterile technique when changing the dressing. Under the central line dressing, a Gardiva patch is placed over the insertion site. This patch has both antimicrobial and hemostatic properties. The patch should be changed with every dressing change. Swab caps are alcohol-based and are applied to PRN adapters of all IV sites. They should be applied to the Y site of IV tubing as well. The swab caps should be changed every time they are removed, or at least every Thursday. PRN adapters on central lines should be changed on Mondays and Thursdays and PRN. We scrub the PRN adapters of IV sites with site scrub for 8 to 10 seconds every time the line is accessed. Lure locks are applied to the end of IV tubing whenever it is disconnected from the patient. In an effort to eradicate all hospital-acquired infections, our hospital is basinless. Instead of using bath basins, we use prepackaged bathing wipes every day except Wednesdays. There are 8 cloths in each pack, and a separate cloth should be used for each body part. We also have prepackaged CHG wipes that should be used on ICU and central line patients. Use a separate cloth for each body part. An important thing to remember is that CHG wipes should not be used on the perineal area, face, mucosa, or open skin. Every Wednesday, the patient should be given a bag bath instead of using the bathing wipes. We should use 8 washcloths, no rinse foam wash, and warm water. CLABSIEs are preventable, and by working together and following the guidelines outlined in this video, we can protect our patients from CLABSIE.